Hello, everybody. My name is Ethan, and I am a CFI in training. It has been a little bit since I did my initial CFI training, and now it's a little bit until my check ride. So I figured, let's see if I still got it. So, in our previous video, we discussed some human factors straight from the private pilot's ACS task hotel, and we discussed hypoxia and hyperventilation. So, in today's video, we're just going to go a little bit more down the list, not get too awful into everything because that would be a really long video. So in today's video, we're just going to talk about the middle ear and sinus problems, spatial disorientation, motion sickness, and then also dabble a little bit into our optical illusions. So, one very important thing for us to remember, for us to know at the very beginning is that as humans, we experience the world and experience things through three different systems. We have the vestibular system, somatosensory system, and then the visual system. So the easiest one to remember is the visual system. We experience things through our eyes, and that is one way that we are able to intake this information and make sense of where we are. The next is the somatosensory system, which is just our nerves and our skin and our muscles and joints that also can sense our position and sense based on gravity or our feeling or sound. And then we also have our vestibular system, which is the one that we concern ourselves the most with as pilots, which is essentially just organs in our inner ear, and they sense positions based on the way that they're balanced. So we'll talk about that a little bit more here in a second, and let's just get right into it. So the first and I would say easiest thing for us to remember here is our middle ear and sinus. So essentially, as a human, we all have a pretty good setup right here where it's set up where we have our ear outside right here, and then it goes into our auditory canal, eardrum, then we have the middle ear and the eustachian tube, and that's where it connects to where our throat is. So if you've ever, been sick or whatever and you get like some snot down in your throat, that's where that connects. Our ear connects to our nose and that whole system down in the throat. So one important thing to remember with that is if you've ever been sick or had a sinus infection or anything like that where you've got a lot of pressure in your head and maybe you have some elevation changes, if you're driving in southern Indiana and there's some hills, sometimes you'll be going down some hills and your ears won't necessarily pop. Well, that actually is very easily explained in aviation. So essentially, we know as pilots that air always travels from high pressure to low pressure. That is just the matter in which air always travels. So then, if we can apply some logic, we can think through how some blockages in our ear and in our sinus, if we were to have, like we said, congestion or any sinus infection, that could cause some issues. So this is how I like to think about it. So let's say that I had a blockage in this area right in here. So maybe not a full blockage, some air would seep in, you know, so as I'm on the ground, it's higher pressure on the ground versus lower pressure as we get higher up into the air. So as I'm on the ground, I have high pressure. I have high pressure in this whole area. And also if I have a blockage right here, some of it seeps into that canal right there. So then as I travel up in altitude, it's high pressure inside of here and then lower pressure outside of our ear. So then from there, we would have that air travel from in this area outwards. So not much pressure felt on us in our head or in anywhere. But the issue arises when we're trying to go from high altitude back down to the ground, because once our ears are eventually able to stabilize, whether we pop them by chewing gum or by trying to yawn or the Valsalva maneuver where we close our nose and try and blow out of it, however it is that we equalize that. Eventually, once we start going back down to the ground, we have, once we're back on the ground, we have a lower pressure inside here, higher pressure on the outside. And what happens there then is the high pressure air starts pushing inward towards, you know, our head. And that's when we can have the most discomfort, is when we've got that pressure all pushing in on just on our head and in that whole area. And me personally, I've been flying one time before when I had a sinus infection, and this was on a commercial jet, and when we went down to land, I actually had my eardrum burst because there was just so much pressure pushing in. So one thing that we can take away from that is just risk management wise, we don't want to ever fly if we're sick. You don't, it would be very debilitating to have an eardrum burst, especially if I was on a solo or if I was flying with my family. I wouldn't want to have something like that happen and become so debilitated that I could no longer operate the aircraft. So it's just safer to stay on the ground. So if you're ever sick, if you're ever having any issues like that, just wait a few days. Just let it get better, and then you'll be good to fly. And trust me, it is very painful. You don't want to go through that pain either. So that is our middle ear and sinus. The next is the vestibular system. So the vestibular system, essentially it looks like this. So, you're wondering what the heck is all that. What we focus on as pilots, again, is these three different canals, or semicircular canals, as it says right there. So we know from our three primary control surfaces as pilots that they control pitch, the up and down, roll, the side to side, and then yaw, the other side to side. So in these three semicircular canals, they all sense those three motions: the pitch, the roll, and the yaw. So the way that it works is it has a fluid inside those canals, and as it moves around, as I tilt my head this way, this fluid is moving inside of my head, and there's little hair cells that are in there. And when those hair cells are like touched by that fluid, that's how you're then able to sense that position inside that vestibular system. Because again, we talked about this before. We have organs in the ear with our vestibular system. They sense the position based on the way that they're balanced. So if I tilt my head this way, that fluid's moving inside my vestibular system, trickling over some of these little hair cells, and then that is what's giving me that sensation. And that is when partnered with my eyes right now, looking at this camera, I can then see, hey, my head is tilted. And that's just how those all work together. They send that information to your brain, and your brain makes sense of all of it. But what can then happen is we get into our motion sickness. So motion sickness is essentially when our vestibular system and our visual system are not making any sense together. So let's say that if anybody's ever been car sick, a lot of times if you just look out the window, you end up feeling better. Look out the windshield. And the reason that is let's say that I'm sitting there on my phone while I'm in the car, and I'm in the backseat of the car, and I'm sitting here looking down like this. But I'm still feeling all this movement outside in this vestibular system, because again, it's just based on how you're balanced. You're bouncing with the car. If you turn a lot, your head tilts this way. So when I'm getting mixed signals in my brain, because my visual system is just seeing this thing right in front of me, no movement, but my vestibular system is feeling this movement, as well as my somatosensory system. And those mixed signals are what can make someone motion sick. And when someone is motion sick, they get very nauseous. And as pilots, that can be, if I'm flying as a brand new private pilot, if I'm flying somebody for their first flight and they get motion sick, that can be a pretty big risk factor, because it can be very easy to get distracted. And we really need to know what tasks we have to prioritize then. So in that instance, with motion sickness, there's a few things that we can do. The very first thing is come prepared. Have 6 sacks or some sort, Walmart bag, whatever you need to be able to use if someone were to get sick. But let's say that someone is getting sick or has gotten sick, is still motion sick. What you want to do is you want to, for one, open the windows, get some fresh air on them. Maybe not the windows, you can also open the air vents. Just getting some fresh air on them can help. You can also tell them to focus outside of the aircraft, so to look outside rather than inside. And then you can also have them just hover their hands over the controls so that they can feel, engaging that somatosensory system so that it's all going to make more sense, so that they can feel the turns or the inputs that you're making so that they can have a better understanding in their body of what all is going on. Motion sickness, like I said, it can be a very big risk factor, very distracting. So we just want to be cognizant of that. We want to be prepared for it, and then just knowing how to deal with that is a very important thing. So the last thing that we talk about is our vestibular and optical illusions. So with that, there's one main thing that we typically remember. So ice flags. And ice flags stands for all these different illusions that we have memorized as pilots and understand. And the main thing with any vestibular illusion, which is, I would experience a vestibular illusion if I was flying and let's say my visual was taken away. As private pilots, we fly under the hood where we can no longer see outside. Or if I'm an instrument pilot and I'm flying in IMC, then I will not be able to see outside. Then my body is solely getting information from the vestibular system that is accurate, and that somatosensory system. So when we get rid of that visual, that's when we can start having these problems, these illusions. And the most important thing with these vestibular illusions, with any of these illusions, is just to rely on your instruments. You just want to be able to completely trust your instruments and look at them and say, I know I feel like I'm turning right now, but I look at my attitude indicator and it is saying that I am straight and level. So I'm going to trust that because we've done our pre-flight. The airplane has been maintained well, presumably. So we can trust those more than we can trust ourselves when we're in clouds or when we're in a very low visibility situation or whatever it may be. So going into ice flags. So we have inversion, Coriolis, elevator, false horizon, leans, autokinesis, graveyard spiral, and somatographic illusion. And we're just going to kind of rapid fire through these because going into all of them in depth, again, would be a very long video. So inversion illusion, essentially, if I'm in a climb and then I go from a climb, I'm sitting back in my seat because I'm in a climb, to straight and level. When I pitch the nose down, it makes me feel like I'm falling backward then in my vestibular system. So again, with that, we just want to trust our instruments, realize that we are not falling backwards actually. The next is the Coriolis illusion, and it's essentially if I'm turning steadily in one direction for a really long time, and then let's say I dropped a pin and I'm like, oh crap, I gotta pick up this pin, and then I move that really quickly, then I can become extremely, extremely disoriented really, really fast. So it's important with the Coriolis illusion to just keep minor head movements. If I'm in a turn or I'm doing anything in clouds, I don't want to be moving my head real aggressively. I just want to keep minor head movements to present this one, because this one can also make you extremely sick. The elevator illusion has to deal with up and down drafts. So if I was flying along in a cloud and I got an updraft, then I might think that I'm in a climb. And if I'm flying in cruise and I get into a climb, what I think is a climb, my reaction is going to be to push my nose down. And again, that's just one of those things where you can get yourself into a dangerous attitude, especially if I got a downdraft and I now feel like I'm descending. If I pulled my nose up real rapidly, I could get myself into a bad attitude, possibly even a stall, depending on how aggressive I was in reacting to that. So again, trust your instruments. False horizon just has to deal with, let's say that I'm flying at night and I see if I'm flying next to the coast and I see the coastline, or if I'm flying and I see a layer of sloping clouds, then I can eventually, and this is more of a visual illusion, but I can eventually trick myself into believing that that is the horizon. And if I'm pointed towards that, I am straight and level. And as you can see in this picture, that can put you in a completely different attitude than what's actually true. And that's why we focus on our instruments. The leans is in a prolonged turn. Um, we don't realize that we get into this prolonged turn because it happened at a really shallow entrance into the bank. And essentially, I might be in a shallow right turn, but then when I realize I'm in that right turn and I go to straight and level, I now feel like I'm turning left because the fluid in my ear has told me that this shallow right turn is actually straight and level. So it's just important then when you're disoriented there, like we've said time and time again, trust the instruments. Autokinesis, that's a visual illusion. It is essentially if I'm flying at night and I am looking at a light for too long, it can then appear to move. So it's just important, if I get visual reference with the airport that I'm trying to fly into at night or whatever, and I'm looking at the beacon, maybe not focusing on the beacon directly for the entire time, because that then can cause me to perceive it as it is moving. We then have graveyard spiral, which is you're getting into a gentle turn. You don't notice that you do, but as we get into a turn, we know that we lose that vertical component of lift for some horizontal, so we start descending. And then what we do is we notice we're descending, so we pull the nose up to get back to our altitude. As that happens, we tighten the turn and we get ourselves into possibly a stalled condition, anything like that. That's one that, I'm sitting here thinking, and I'm like, holy crap, how in the world could you sit there and not notice for that long to where you could spiral so slowly all the way down into the ground and have a controlled flight into terrain incident? And it's like, what if it was late at night and hard IMC? Or what if it, insert any possible thing? We can't believe that we are invulnerable to anything like that. So again, it's just important to understand that. And somatographic has to do with acceleration and deceleration. So if I accelerate, so let's say I was in low visibility going to take off. When I do that acceleration, it pushes me back in my seat, and that then, via my vestibular system, makes me believe that I am pitching backwards or pitching up. So, and the antithesis of that, if I was to pull my power out really rapidly, I could feel like I am pitching down. And that can, especially low to the ground, get us in some difficult situations. So again, if you remember anything from any of this, we want to trust our instruments. That is the main thing that we want to do with any vestibular illusion, anything like that. Lastly, we can talk a little bit about some of our visual illusions. And here's just a few. This is straight out of the Pilot's Handbook of Aeronautical Knowledge, Chapter 17. And these are just some runway width illusion, runway slope illusion. And it just has to deal with, let's say that a runway, if I'm used to flying into a 200-foot long or 200-foot wide runway, and now I'm going and landing at a 50-foot wide runway, it's going to make me think that I'm higher than I normally am because I'm used to the runway being a lot bigger. So when I think that I'm higher than I actually am, I'm actually going to come in flying lower than normal, which can be dangerous. Especially if there's terrain or trees or anything like that. And then vice versa, if I'm from a not very wide runway going into a super wide runway, I can come in a lot higher. And that's where we want to use our PAPIs, our precision approach path indicators, just to tell us, hey, I got 2 white, 2 red, I'm on glide slope, I'm going to keep going down. It's also one of those things that you get a sight picture idea, a visual idea of what it looks like as you fly more. So just pay attention to that as you're doing it. Don't become too over reliant on the PAPIs or the VASIs or anything like that. Down sloping versus up sloping runways. If it's down sloping, I can think that the aircraft's lower than it actually is, so I'll come in higher, and vice versa. And then there's a few other visual illusions that we can have as far as, featureless terrain. So if it was a really dark night, no moon, and I'm flying down low, let's say I'm on final coming into a runway, and this area has no lights, it can just look like a complete black hole abyss, and that is featureless terrain. If it's real dark, it can look like just pure darkness, and because of that, we can have a lack of knowledge of how high we are off the ground. And again, that's where we can use that sight picture that we've gained, as well as we can use our PAPIs and our VASIs. Haze also can make us think that we're further away from something than we actually are. So that's where we can, if we have a plane that uses GPS or if we have DME, we can utilize that to tell us, hey, how far are we? Because if I'm coming into a runway and it's super hazy, I could be a few miles out and still at my cruise altitude, but I would want to have started descending, once I got visual sight of the runway. So that's just an important thing there. And then essentially ground lighting illusions, which is this last one that we'll focus on. That is if I'm flying at night and if I were to have, a really big road, like an interstate that is in the area where I thought the runway was. If I have a well-lit interstate or a well-lit road and those lights are on either side of it, I can mistake that for a runway. So it's important for us to recognize that risk and keep focused on it, and just make sure that we are using all of our possible tools to have situational awareness to be like, okay, this looks like the runway, but it is not. So whatever feature you got to use, whether that be an instrument approach or GPS or an OBS feature or whatever it is, use that to help you to locate the runway. Focus on the beacon as well, things like that. You can always ask if there's a traffic control tower there. You can ask them to turn up or down the lights to help you find the runway. Or if you're going into an untowered field with pilot controlled lighting, you can just flick those lights on a little brighter or make them dimmer. So that is all that I have for this video, talking about the middle ear and sinus, spatial disorientation, motion sickness, and optical illusions. And as far as all of this goes, just having an idea is very important of what all of this is. It more affects you, like vestibular illusions more affect you in instrument, but just understanding that, hey, if I ever found myself inadvertent into instrument conditions, flying into clouds on accident, I should understand that I will get disoriented very fast. So I need to focus on my instruments. I need to trust them. I need to have a good scan developed and be able to safely maneuver out of that. As well as, we just want to know what tasks to prioritize. From this risk management section, this is a very big thing. Disorientation we talked about. Keeping situational awareness is something that just means we're using all of our available tools. And then managing those distractions. What things do we need to prioritize? And at the end of the day, we know that the main things are aviate, navigate, communicate. So we want to fly the plane first, navigate it then, communicate it last. So even if I have a very upset passenger in my plane, or they're throwing up or whatever, I need to get us to the ground safely first and not focus on, whatever they may be doing. So I can help them, but if it comes down to it, I need to focus on the task at hand most importantly. So that's all I got, and thank you for watching.